Yeah, so it is discussing safeguarding in a small NGO, but I wanted to talk about some of the challenges of trying to do safeguarding in international development, so overseas. It is not because I have all the answers, but just because this is something that we have had to work through as an organization with Restored Hope Zambia. So as it was mentioned earlier, the organization deals with abuse in churches in Zambia, focusing on supporting survivors, but also looking at some of the contributing factors to that in relation to safeguarding. So one of the key one of the reasons why abuse is such a huge problem in Zambia, in many institutions, not just the church, is just a lack of safeguarding awareness, a lack of safeguarding provisions and implementation of those. So it is in that context that, okay, we want to do safeguarding well, we want to do it better, we want to create churches that are safe, institutions that are safe for children, for vulnerable adults. So how do we do that well? So I'll just start with thinking through like some of the challenges of why it's difficult, or why it might be difficult to implement that. And I'll share a little bit of my background here. So I studied law, and I always think, and if you give me a problem, I'll give you some kind of legal solution to that. So my brain always works in, well, right, we need to reform policy, we need to reform legislation, the law is always my go-to. And I've noticed that in a lot of our safeguarding training, we appeal to the law, we appeal to legislation, and legislation is a good thing. It helps to motivate, I guess, even unwilling participants. So people who don't want to do safeguarding are still required to do it because there are penalties to not implementing safeguarding in your institution if you don't. But what if there are no provisions for that? So what happens if you are working in a country where there is no safeguarding legislation? Like where do you go from that? What do you appeal to at that point? And what if even if there is some kind of provision for safeguarding? So for example, in Zambia, just about last year, October last year, a piece of legislation was passed, the Children's Code Act, which reformed a lot of areas in relation to safeguarding, especially in relation to children. So that legislation exists, but implementation is so bad that every time we've surveyed church leaders asking them if they have an actual proper safeguarding policy, most of them, even in really, really big churches, say no, they are not aware of this legislation. And there are no penalties in reality for not implementing this. So you have the appeal to authority in that situation, or the United Nations Declarations, Rights of a Child says, just doesn't really work. There is no motivation to implement because the law says, because sometimes the law doesn't say anything, and other times, even if it does, nobody's really paying attention to it. So that is one problem. The other problem is just system inadequacies that can sometimes arise in some cultures. So for example, we were trying to implement safeguarding with our partner charity. So for context, by the way, I am the founder of Restored Hope Zambia, which does work in Zambia, but I also I work with trustees on the Scottish end with a Scottish partner charity. So part of that partnership is just looking at safeguarding frameworks, primarily from Scotland, and looking at comparing that to Zambia and saying where are the gaps and where could this be done well in collaboration. But part of the challenge of implementing safeguarding is it requires you to report things sometimes. Okay, this has happened, you call an ambulance. If this has happened, you call the police. But what if you call the police and they don't show up, or they're asking you for transport money before they come? What if there's no sense of urgency with those institutions? Like, what do you do then? So you have those system inadequacy challenges that actually the institutions that are responsible for implementing this, whether it's law enforcement, whether it's hospitals and potential safeguarding there, or even just social workers. There's simply not enough of them. I know there isn't here in the UK as well, but just in comparison, just not enough to implement, especially in relation to children. So that's another challenge. Then you have just a clash of worldviews and the authorities that people appeal to. So you might go to a village somewhere and say, well, the United Nations Declaration's Rights of a Child says, but actually they care more about what the chief says because that's the authority in that community. They don't care about what some international declaration said, and that has no bearing on their lives. And so the appeal to that authority does not work in that situation because actually people are looking elsewhere to get their guidance for what is right and wrong. And you just have a clash of worldviews sometimes. So we might start from saying, actually children have rights, for example, and they have the right to be treated in this way, perhaps a human rights framework. But actually in some cultures, the community or the group takes precedence, a priority over the individual. So if there's a situation, some kind of incident, the community might decide to, for the purposes of a community, that doesn't need to be reported. Let's not report this to the police because what's going to be the impact on the community? We see that in just general broad communities, but actually we see that in the church in Zambia, which is why Restore Zambia does what we do. So those are some of the challenges of, depending on where you're doing your work, implementing safeguarding effectively. I say effective because sometimes we can do safeguarding as a tick box, right? We've got a policy, it's there, we've ticked the box, we can apply for funding, or if somebody comes to check, we're fine. But actually, if you want to do effectively, this is a system we've created that we want to actually work effectively to prevent harm from the most vulnerable. If we want to do that, then these are some of the challenges we have to consider and work through, and there are no easy answers. I want to just suggest a few helpful things to consider in that climate, which is actually just shifting worldviews, shifting mindsets in order to shift the whole culture. And that is very, very difficult to do. It takes a very long time, but it is doable. And the first thing is, I think, one of the principles of this network, which I love, which is collaboration. So if you are working with a partner in international development, it's easy to maybe say, right, just make sure you have a safeguarding policy, and you might give them a template and say, have that. But actually, that's not going to work because, I mean, they might just do it for the sake of doing, okay, we're getting money out of this, let's just put something together to tick that box. That's not going to be helpful for anyone. But actually, there's a way in which that can be done collaboratively. So we're thinking of the principles of safeguarding. What do we mean when we're talking about safeguarding? What is it about? Okay, it's about protecting ourselves. It's about protecting those who are most vulnerable. It's about creating an environment where people can flourish. So by starting with those principles, we can help our partners tap into their own worldviews, so mutual values that can come about. And I'll give a practical example of how we do this in the context of a church setting. We've done some safeguarding work with faith leaders. And one thing that they do say is, well, lots of nonprofits come and do all this work around safeguarding, but church leaders don't really engage or pay attention to it because it does not relate to their worldview. In terms of the church leaders, the faith is the thing that's most important to them. And if that's not engaged, that's not going to be effective in helping them think of, why do we do safeguarding? By implementing in that particular scenario a theological framework, we tap into mutual values. So we start to think about why do we care about people? Why should we care about the vulnerable? Who are the vulnerable? Why are they vulnerable? What would it look like? And that collaboration means that they are creating, in effect, their own safeguarding cultures. They are thinking through things themselves. And at that point, it's possible to challenge some wrong assumptions and wrong narratives because you're tapping into something that they already hold dear, that they already value. It doesn't mean we completely ditch the legislative framework. We would still have, the principles in international law, and this is what the legislation says. Even if there isn't explicit legislation in safeguarding, there might be other legislation around caring for vulnerable people that we can tap into and appeal to that and say, by the way, the law says this. But we in a situation where that might not be effective, one of the helpful ways is just starting to think about how can we transform these cultures so that they're not thinking, for example, in the case of, let's protect the reputation of the community, who is part of that community? I would challenge that worldview by saying, who is in that community? Or is a child part of the community? Is this vulnerable person part of the community? How are you protecting them? Because remember, their authority or their ultimate value is community and protecting the community. You shift that on its head and say, what about this person within the community? What does it look like to care for that person as part of the community? So I just wanted to bring in that aspect just as a helpful way to sort of bring that in our safeguarding, which in practice is going to look like safeguarding training that's just going to be more of an ongoing thing rather than sometimes how we traditionally see it as a session here. You attend training and that's done, but it's just going to be something that's going to have to be threaded through probably different aspects of the work and what we do and how we do it. So that is me. That is what I wanted to share. I'm just going to stop sharing. Come back.
Wonderful. Thank you so much for bringing that to this group today. I'm going to stop recording so that we can have an open